the lower limb. This is actually what carries our weight and transmits it down to the earth, right? When we are in an upright position. When we talk about the lower limb, there are three parts. There is the thigh. And the thigh consists of the femur. So again, one bone, and then in the leg, which is technically like what we tend to think of as like our lower leg, then this would be the tibia and fibula. So we have two bones. And then we have the foot. So again, we have a bunch of bones, which in this case are called tarsals. So those would be kind of analogous to our carpals, but they're in the foot. The tarsals, the metatarsals, and the phalanges. Phalanges. Okay. So let's look at the structure of your femur. Your femur is the biggest bone in your body. And it's kind of interesting because it articulates with the acetabulum of your coxal bone. It articulates over to like the side, right? So your leg is actually coming off the side. And so it is connected. There's a long neck in your femur. This is the head right here. There is a little pit in the head called the fovea capitis. And we're going to talk about that when we get to the hip joint, because this is a place where you have a ligament that attaches the head of the femur to the acetabulum, and it makes the hip more stable. So that is where a ligament attaches. When we look at the femur, we'll notice that there, instead of tubercles like we have on the humerus, we have trochanters. And so we have the greater trochanter right here, or right there. And then we have the lesser trochanter, which is medial. So I don't know if you can feel your trochanters, but that is where muscles attach, like your thigh and butt muscles attach. Many of those muscles will attach to your trochanters. When we look at the, oh, I forgot the patella as part of that, but when we look at the femur, at the proximal end, it has the head. At the distal end, it has condyles. So these are the big condyles right here. The femur at the distal end articulates with the tibia and the patella. So the femur at distal end articulates with the patella, which is on the front of the knee joint, and the tibia. The tibia is your larger lower leg, or your leg bone, right? So it is much larger than the fibula, and the fibula actually doesn't articulate with your femur at all. It articulates with your tibia. We're also going to talk about this joint when we get to joints, because there are cartilaginous discs, fibrocartilage discs called menisci that are in this joint, which actually allow the joint to have a deeper articulation and makes it more stable. So if you like put a femur and a tibia together, you're like, I don't even see just the bones. You're like, I don't even see how they stay together. But it is a deeper articulation when you put them together and you have those discs that have a deeper groove in them. So you'll notice this is the anterior. So this would be the front of your femur, and it has a patellar surface that would articulate with the patella. So we have the patella. The patella actually sits, so its apex is down on our knee right here. So this is the patellar surface that helps to sit right, or not the patellar surface, but this is the facets, the shallow joints on the patella that articulate with your femur. So the patella is actually a sesamoid bone. What does that mean? That means that it forms in connective tissue, specifically in a tendon that comes over the knee. And so it forms in there and it helps to protect the front of our knees. So we can, like, for example, kneel on the surface of our knees. When we look at the tibia and fibula, you can see here that these are the surfaces of the tibia, which would receive the condyles of the femur. So the condyles of the femur actually sit there, but again, there's the menisci that deepen that articulation. You'll see that the fibula, the head of the fibula, articulates with a region on the tibia. And then if we look down at our ankle joint, those big knobs where it hurts so bad when you hit them, right? Those are not actually part of your ankle. They are actually the lower leg. And so here we have, these have interesting names. These are called the malleolus. So on the tibia, and this would be distal, we have the medial malleolus. So that is that knob on in your ankle region. Medial means it's towards the inside. So this would be towards your toe, big toe side. Your big toe is called your hallux. So this is toward big toe side, which is called the hallux. Remember, your thumb is called your pollex. I didn't spell that right. Hallux, it's UX. The hallux is your big toe. Okay. So these are the bony regions. Gosh, this looks an awful lot like the radius and the ulna, right? You have this interosseous membrane, right? But when you think about it, there's not a lot of rotation going on in that particular region. When I'm like rotating, I can't like really take my foot and turn it, I'm doing it at my knee and my hip when I'm moving. So the lower leg does not have as much mobility as the forearm, okay? But again, it would be kind of analogous or homologous to it in terms of like looking at its structure. Okay, the foot. What does the tibia articulate with? It articulates right here and is with the talus. So at the foot, the tibia articulates with the talus bone. Okay, and that would be distally because it's further away from my center line, right? So that's the talus right here. Our heel bone is called the calcaneus. So the heel bone, and that would be heel bone, 2 E's. The heel bone is called the calcaneus. Okay. You do need to know the tarsal bones. So sometimes it's easy to remember them based upon their shape. This one is, if we think about it, our pinky toes are on the lateral side. And so moving from lateral to medial here, you have the cuboid, and then you have what are called the cuneiforms. So this is the lateral cuneiform, the intermediate cuneiform, and the medial cuneiform. And then this bone has a unique name, which is called the navicular. Okay. So these are the bones of essentially your ankle joint. Okay. But really, the ankle joint would be just right here because that's where it articulates with the lower leg. Anyway, so this would be part of the foot. Okay. So we have the tarsal bones, then we have the metatarsal bones. They're actually long bones. Look at, they are longer than they are. You can curl your toes and see those knuckles, right? This would be your big toe. It only has 2 bones, just like your thumb. It's not really opposable, but here are the 3 bones in your phalanges. So very similar in structure to the hand.